You're not dying, but your brain thinks you are. Right now, in the next few minutes, I'm going to show you exactly what happens inside your brain during a panic attack. The sequence, the milliseconds, the specific neurons firing. And once you understand it at that level, not the symptoms, not the feelings, the actual neuroscience, you will never be as afraid of it again. Here's what most people are never told. A panic attack is not a sign that something is wrong with your character. It is not a sign that you are weak, fragile, or broken. It is a neurological event. It has a name, it has a mechanism documented in peer-reviewed journals, and it has a precise biological point of interruption that researchers at Stanford University identified and tested in a clinical study published in 2023. That protocol stops a panic attack in 45 to 90 seconds. Not meditation, not counting to 10, not telling yourself to calm down. A specific breathing technique called cyclic sighing that directly activates the parasympathetic branch of your vagus nerve and reverses the physiological cascade of a panic attack in under 60 seconds. And the reason your doctor has probably never mentioned this has nothing to do with secrecy and everything to do with the fact that this research is only now reaching medical curricula while it has been sitting in peer-reviewed journals for years. Have you ever been in the middle of a panic attack and genuinely believed you were dying? Drop that in the comments. I read every single one, and I promise you, you are not alone in that moment. Hi, I'm Dr. Marcus Cole. I'm a neuroscience communicator who has spent years studying how the brain's fear systems work, and more specifically, why those systems sometimes fire in ways that are terrifying, disorienting, and completely disconnected from any real danger. What I discovered when I started looking at how the amygdala interacts with the vagus nerve completely changed how I think about panic disorder. And today I'm going to show you exactly what the research says, how this works at the neurological level, and the precise protocol tested in clinical studies so you can start using it this week. Here's what we're going to cover. First, the exact neurological sequence of a panic attack. Most people have been told what panic feels like. Almost nobody has been told why, at the level of neurons, milliseconds, and brain circuitry. Second, why the panic cycle amplifies itself, and the single cognitive error that turns a 10-second alarm into a 20-minute crisis. Third, the Stanford 2023 protocol that interrupts the cycle at its biological root. And fourth, how to rewire your fear response over 4 to 8 weeks so this happens less and less, not just how to survive it when it does. Before we go further, if nobody has ever explained your own brain to you in plain language, that is exactly what this channel is for. Every video here is built on real peer-reviewed science. No vague promises, no sensationalism, just the neuroscience clearly explained. If that's what you're looking for, hit subscribe so you don't miss what's coming next. Let's get into the science. Here's something that happens in your brain in the middle of the night, in a grocery store, in a meeting, in a car, with no warning and no obvious trigger. Your amygdala fires. The amygdala is a small, almond-shaped structure buried deep in your temporal lobe, and its entire job is one thing: detect threats and trigger a survival response before your thinking brain has time to evaluate whether the threat is real. And here is the number that changes everything: 200 milliseconds. In 200 milliseconds, less than a quarter of a second, your amygdala can receive sensory information, classify it as dangerous, and launch a full physiological emergency response. Adrenaline into the bloodstream, heart rate spiking, breathing becoming shallow, muscles tensing, digestion shutting down. All of that before your conscious mind has processed a single thought. Think of it like a fire alarm in a building. The moment the smoke sensor detects particles in the air, it doesn't wait for you to wake up, walk over, smell the smoke, and decide whether to evacuate. It fires immediately. The alarm goes off first. You figure out whether the fire is real second. That's your amygdala. It fires first. Reality check comes second. The problem is, in people with panic disorder, this alarm is calibrated too sensitively. It fires in response to internal sensations. A slightly elevated heart rate, a moment of lightheadedness, a breath that didn't feel complete. Sensations that are completely harmless. But to the amygdala, in that 200 millisecond window, they look like danger. That's why you can wake up at 3 a.m. with your heart pounding and no idea why. That's why a panic attack can hit you in a moment that was perfectly normal just seconds before. That's not weakness. That's a miscalibrated alarm system. And the distinction matters because you can recalibrate an alarm. You cannot willpower your way out of a neurological reflex. Have you ever had a panic attack with absolutely no obvious trigger, completely out of nowhere? Tell me in the comments. The patterns people share there are always illuminating. Now here's where it gets more specific, and this is the part that most people, including most therapists, never explain clearly. Your brain processes incoming information through two completely different pathways simultaneously. Researchers call them the low road and the high road. The low road goes directly from your sensory organs to your amygdala, bypassing your thinking brain entirely. It is fast, crude, and emotionally powerful. It arrives in 200 milliseconds. The high road goes from your sensory organs through your sensory cortex into your prefrontal cortex, where rational evaluation happens, and then to the amygdala. It is slower, more accurate, and contextually intelligent. It arrives in approximately 500 milliseconds, 300 milliseconds. That is the gap between panic and reason. In those 300 milliseconds, your body is already in full emergency mode. Your heart is already accelerating. Your palms are already sweating. And then, 300 milliseconds later, your prefrontal cortex arrives with the evaluation. There is no real danger here. But by then, the physiological response is already running. And here's the critical problem. Now your prefrontal cortex isn't fighting an external threat. It's fighting the sensations that the amygdala itself just created. Your rapidly beating heart, your shortness of breath, your shaking hands. Those sensations are real, and your high road brain is now trying to interpret them. If your brain has learned through previous attacks or through anxious attention to interpret those sensations as dangerous, it sends a second alarm signal to the amygdala, and the amygdala fires again, harder this time. That is the panic cycle. That is the exact mechanism by which what starts as a 10-second alarm becomes a 20-minute crisis. Not weakness, not irrationality, neuroscience. But that's only the first mechanism. And honestly, not the most dangerous one. Wait until you hear what happens next, because this is where the research gets genuinely concerning. The panic cycle has an amplifier built into it, and the amplifier is attention. When your heart starts racing during a panic attack, something very specific happens in your prefrontal cortex. You focus on it, you monitor it, you track every beat. You're trying to figure out if this is the real thing, the heart attack, the stroke, the loss of control, or just the panic again. But the act of monitoring your heartbeat with anxious attention is itself a signal. Your amygdala interprets intense focus on internal sensations as evidence that something important and dangerous is happening. So it doesn't stand down, it escalates. Researchers studying the cognitive model of panic, updated in 2022 by Professor Michelle Krask and colleagues at UCLA, reviewing neural mechanisms of fear in adults with anxiety disorders, documented this mechanism precisely. Adults who learned to observe their own physiology with neutral attention rather than anxious scanning showed a dramatically different panic trajectory. Not because the sensations changed, because the interpretation changed. Think of this like a car alarm in a parking lot. The first time you hear it, you look up, fully alert, ready to act. But if that alarm has been going off every morning for 3 years, what happens? You stop responding. Not because it got quieter, because your brain recalibrated what it means. That's what's happening in people who recover from panic disorder. Their amygdala doesn't stop firing, it fires differently. The signal gets processed differently. The catastrophic interpretation loop gets interrupted. That's why you feel completely fine for weeks, and then the attack returns seemingly at random. That's why some days you can manage it, and other days you simply cannot. That's not failure. That's a nervous system that hasn't yet learned the difference between sensation and danger. And that is a distinction you can teach it. Before I go further, I need to say something directly. What I'm describing in this video, the amygdala hijack, the panic cycle, the vagal protocol, this is the foundation, the essential neuroscience that nobody ever explained to you. And once you have it, everything changes. But a foundation is not a complete system. And if you're watching this because panic attacks are genuinely disrupting your life, because you've started avoiding places, situations, experiences, you need more than a single protocol. You need a complete neurological reset. That's exactly what the 30-day brain reset system was built for. Your doctor never told you that chronic stress is physically shrinking your brain, that poor sleep fails to clear the proteins linked to Alzheimer's, that the food you eat is either rebuilding your neurons or slowly destroying them. They never told you because nobody taught them the neuroscience. But it exists. It's published in Harvard, Nature, JAMA, and Stanford, and it changes everything. This system translates that science into 10 complete peer-reviewed protocols, covering anxiety, depression, ADHD, memory, brain aging, and neurological nutrition, including the full 30-day anxiety and brain protocol that expands everything I'm covering today into a daily step-by-step system, including the Alzheimer's Defense Protocol, the ADHD Brain Rewiring Guide, and the Brain Food Bible. 47 foods ranked by neuroscience, every dose explained, every protocol, every study, every DOI link, no guesswork, no false promises. Your brain grows new neurons when you give it the right conditions. It clears toxic proteins when you sleep properly. It rebuilds what stress destroyed when you follow a protocol built on actual science. For 30 days, this system gives you exactly those conditions. The link is in the description. Now, let's get back to the science, because the vagus nerve is where everything changes. Here's what your body has that almost nobody tells you about: a biological emergency exit. It's called the vagus nerve, and it is the longest cranial nerve in the human body, running from your brainstem down through your neck, your heart, your lungs, your diaphragm, all the way to your intestines. It is the main highway of your parasympathetic nervous system, the system responsible for the opposite of fight or flight: rest, recovery, calm. And here is the detail that makes everything in this video practical. The vagus nerve has a switch, a way to activate it deliberately, a way to move from the alarm state to the recovery state, not by thinking your way out of it, not by telling yourself to relax, but through a specific physical action that speaks directly to the nervous system in a language it understands before the prefrontal cortex comes back online. That language is your exhalation. Researchers studying respiratory vagal nerve stimulation, including Gorman and Sloan, publishing in Depression and Anxiety in 2000, and Zaccaro and colleagues at the University of Pisa, publishing in Frontiers in Human Neuroscience in 2018, reviewing 15 controlled breathing techniques in 38 participants, established a consistent finding. When your exhalation is longer than your inhalation, your heart rate drops, blood pressure decreases, and the parasympathetic nervous system activates. Think of your nervous system like a car engine running at full throttle. Your inhalation is the accelerator. It activates the sympathetic system, speeds up your heart. Your exhalation is the brake. It activates the parasympathetic system, slows everything down. During a panic attack, you're all accelerator. Short, rapid, shallow breaths, each one signaling to your brain, emergency, emergency, emergency. The protocol we're about to cover gives you the brake, and not just any brake, the most effective one identified in clinical research. Is this the first time someone has explained to you why breathing works? Not just that it works, but the actual mechanism behind it? Tell me in the comments, because I'm genuinely curious how many people have spent years being told to just breathe with absolutely zero explanation of why. In January 2023, a study was published in Cell Reports Medicine by researchers at Stanford University. Lead author Dr. Melis Yilmaz-Balban. And I'll be honest with you, when I first read this paper, I went back and checked the methodology section twice, because the results were that clean and the implications were that significant. Here's what they did. They studied 114 adults between the ages of 18 and 65, randomly assigned to one of 3 daily practices: cyclic sighing, box breathing, or mindfulness meditation, practiced for 5 minutes per day over 4 weeks. Physiological arousal was measured using heart rate variability, respiratory rate, and validated anxiety and mood scales. The result: cyclic sighing produced significantly greater reductions in physiological arousal than both box breathing and mindfulness meditation. Not marginally greater, significantly greater, across multiple objective physiological measures. And critically, the effect was measurable after the very first session. That is the study your doctor has likely never read. That is the research sitting in a peer-reviewed cell-press journal while millions of people are told to meditate, count to 10, or wait 6 weeks for a therapy appointment. Now, cyclic sighing works through two simultaneous pathways. First, the double inhalation through the nose reinflates the alveoli, the tiny air sacs in your lungs that partially collapse during rapid, shallow panic breathing. Collapsed alveoli cannot perform gas exchange efficiently. That means CO2 builds up in your blood, and elevated blood CO2 directly activates the amygdala's alarm response. The double inhalation mechanically corrects the physiological error that is feeding the panic before the exhale even begins. Second, the long, slow, complete exhalation through the mouth maximally activates the vagal brake we just discussed. It pulls the full weight of your parasympathetic system online simultaneously. This is not relaxation. This is neurological interruption. There is a difference, and that difference is everything. Here is the exact technique used in the Balban-Stanford study. Pay attention to the sequence, because each step has a precise physiological reason. Step 1. Inhale through your nose to approximately 80% of your lung capacity. A full breath, but not maximal. You should feel your chest and belly expand without straining. Step 2. At 80% before you exhale, take one additional short, sharp inhalation through the nose. This second inhalation is the defining feature of cyclic sighing. It forces the remaining partially collapsed alveoli open. It maximizes oxygen-CO2 exchange, and it creates a brief moment of controlled respiratory pressure that makes the exhale dramatically more effective at triggering vagal activation. Step 3. Exhale slowly and completely through your mouth. Not forced, not rushed. The longest, most complete exhale you can produce. This is where the vagal activation occurs. This is the brake being applied. Repeat this cycle 5 times. That is the crisis protocol. 5 cycles of cyclic sighing, taking approximately 45 to 90 seconds total. What you will notice, and this is documented in the Balban data, is that by the 3rd or 4th cycle, your heart rate is already dropping. Your visual field may widen slightly. That's your parasympathetic system reducing the tunnel vision that fight or flight creates. Your hands begin to release tension. The catastrophic thought loop begins to slow. Not because you reasoned your way out of it, but because the physiological substrate feeding it has changed. Now, I want to ask you something directly, and I genuinely want your answer in the comments. Have you ever tried a breathing technique in the middle of a panic attack and had it fail? Tell me exactly what you were doing, because I have a strong hypothesis about why most breathing techniques fail in active panic. And it has everything to do with the sequence of the inhalation, not the breathing itself. Here is the reason most breathing techniques fail in the middle of a panic attack, and this is the insight from the Balban study that almost never appears in mainstream summaries. During active panic, your lungs have a significant percentage of collapsed alveoli. When you attempt slow, deep breathing, the standard instruction you've probably received dozens of times, you are attempting gas exchange through a compromised respiratory system. The CO2 in your blood is still elevated. The amygdala is still receiving the chemical signal that danger is present. You are breathing slowly, but your body chemistry has not yet changed. So the technique feels like it isn't working. And when a technique feels like it isn't working during a panic attack, you panic more. The double inhalation solves this mechanically before the long exhale begins. It physically reopens the alveoli first, and then the exhale has a system capable of fully responding to it. Most people will never know this distinction. Most will try slow breathing in the middle of panic, feel it failing, and conclude in that moment that they are beyond help, that their body won't cooperate, that they are uniquely broken. You now understand exactly why that technique failed. You have the specific modification that the clinical research supports. And that is not a small thing. That is the difference between getting through a panic attack with a sense of total helplessness and getting through it with the knowledge that you used a tool, that it worked, and that you are not at the mercy of your own nervous system. But that's only the second mechanism. And honestly, not the most important one. Wait until you hear what happens at the level of the fear memory system. Because this is where the research gets genuinely surprising and where the long-term solution actually lives. Let me give you the complete protocol, organized exactly the way the clinical research supports it. 3 layers, each targeting a different time horizon. Together they address what a single breathing technique alone never can. Layer 1 is the crisis protocol, what you use in the moment. 5 cycles of cyclic sighing, 45 to 90 seconds. Add to this a cortical anchor. As you begin the breathing, fix your gaze on a single specific point in the room and name 3 visible objects out loud in a low voice. Chair, window, door. This is not a distraction technique. It is cortical re-engagement. The act of naming objects using language directly activates your prefrontal cortex, the rational brain that went offline when the amygdala fired. You are bringing it back online manually, while the breathing addresses the physiological components simultaneously. Both pathways addressed at once. Layer 2 is the daily prevention protocol. Balban and colleagues found that 5 minutes of cyclic sighing every morning, before caffeine, before screens, before any significant cognitive demand, reduced baseline physiological arousal measurably across the 4-week study period. In practice, your amygdala starts each day with a lower alarm threshold, not because of positive thinking, because of a neurological intervention that physically lowered your resting arousal state. 5 minutes, every morning. That is the minimum effective dose identified in peer-reviewed research. Layer 3 is the rewiring protocol, and this is the one that addresses the root, not just the symptoms. It comes from Krask and colleagues at UCLA, publishing in Current Directions in Psychological Science in 2022, studying neural mechanisms of fear extinction in adults with clinical anxiety disorders. The technique is called interoceptive exposure, and I want to explain it carefully because it sounds counterintuitive. And that counterintuition is exactly why most people never reach this stage. Interoceptive exposure works like this. You deliberately induce mild physical sensations similar to the early onset of a panic attack through specific controlled activities. Spinning in a chair for 30 seconds, breathing through a coffee straw for 1 minute, running in place for 2 minutes. The sensations are real, they're not comfortable, but they are voluntary, predictable, and safe. And then, critically, you do not immediately use the crisis protocol. You allow your nervous system to observe that elevated heart rate plus dizziness plus mild breathlessness does not equal catastrophe, does not equal death, does not equal loss of control. The amygdala is not a thinking organ, but it is a learning organ. And what it learns through repeated voluntary exposure to these sensations is the most powerful finding the research has documented in this field, that the sensations themselves are not the danger, that the interpretation creates the crisis. And that interpretation can be changed through deliberate, repeated experience. Krask's research on adults completing interoceptive exposure programs showed a 40 to 60% reduction in panic attack frequency over 8 weeks. Not because patients had fewer physical sensations, because those sensations stopped triggering catastrophic interpretation. Here's exactly what to expect, and I'm going to be precise, because managing expectations is what determines whether people follow through long enough to see the results that matter. Weeks 1 and 2. The crisis protocol shortens your attacks. What used to last 15 to 20 minutes resolves in 3 to 5. That is the first measurable win, and it matters because it shows you the system works before the deeper changes become visible. Weeks 3 to 8. With the daily morning protocol practiced consistently, your baseline anxiety begins to reduce. Attacks become less frequent. The anticipatory hypervigilance, the constant body scanning, begins to quiet. Months 2 to 3. The research shows a 40 to 60% reduction in attack frequency with consistent interoceptive exposure. Not the complete elimination of panic. I will not tell you otherwise. The science doesn't support that. And precision matters here. But a life where panic attacks are occasional, manageable, and no longer organizing the geography of what you will and won't do. Consistency at 80% is worth more than 2 weeks of perfection followed by abandonment. Start with the morning cyclic sighing, get that right. Then add the crisis protocol. Then layer in the exposure work. One question before I close, and I genuinely want your answer. What is the one situation you've stopped doing because of panic? You don't need to share details, just the category: work events, driving, travel, social situations. The comments on that question are always a reminder to everyone reading that they are not alone in this, not even close. And if you're ready to take this beyond today's video, the 30-day brain reset system is in the description. 10 complete protocols, built on Harvard, Nature, JAMA, and Stanford research. The full anxiety protocol that expands everything I covered today into a 30-day daily system. The Alzheimer's defense protocol. The ADHD brain rewiring guide. The brain food Bible. Every study cited, every DOI linked. No guesswork, no false promises. Your brain can rebuild what stress destroyed. It can recalibrate systems that have been misfiring for years. Not through willpower, through protocol. The science was always there. Now you have it. The link is in the description. I'll see you in the next one. Dr. Cole out.